Thank you so much for the honor of speaking about the learner experience today. As stated in a piece in Lancet from early April, students have a paradoxical dual role during this time. They are future healthcare workforce, potentially form part of the response to public health emergencies, but are also considered non-essential in clinical delivery and may be restricted from clinical learning. As learners, our primary role is to do just that, to learn. However, with disruptions in the clinical learning environment causing students to complete school from home, be it remaining in dorm rooms, isolated in their apartments, or back with family and childhood homes, potentially with high-risk family members, these changes undermine a student's ability to function optimally. Medicine is a social discipline, and students typically study with others, have formal small group learning experiences, all of which have turned virtual if they are happening at all. This is forcing students to quickly adapt to new learning styles while trying to keep up with academic milestones, such as summer research, studying for board exams, COVID relief efforts, and generally trying to excel in all aspects of their academic lives. When I approached my own administration about their thoughts on how the pandemic is impacting students, Dr. Lauren Lankowski, who serves as the Director of Programs and Resources for Academic Excellence at our school, basically put it to an analogy, which I won't read verbatim today, but I hope that you have a chance to read it. But she likened it to the idea that students are trying to do very difficult math problems and are doing it as though they're getting tapped on the head every 5 seconds. So it's that this experience has been such a burden on students that how can they do their best academically, let alone on some of the more meaningful work that they are trying to do. This time has posed unique burdens on graduating students in the class of 2020, as many students in different parts of the country have been given the option to graduate early and join the medical workforce or medical corps. And for many, this feels like a very positive way to contribute meaningfully to the relief effort. For others, it actually feels quite confusing and stressful. Many students have great reasons for not wanting to join these efforts. For example, fear of inadequate personal protective equipment, becoming burned out before even starting residency, and students are feeling stigma and fear of judgment for this decision, as you can see from one of these quotes on the slides. Relatedly, many schools have assembled impressive student workforces for all students, not just MS4s. And just as with the graduating students, there is a felt obligation or hidden inability to say no to participating in these efforts, all of which can be emotionally challenging for students. So as leaders putting together these opportunities, we must build in opportunities for students to deliberately process these experiences and find that balance between meaningful engagement and undue burden. And finally, we have an opportunity to take best practices for this time, things that are working really well, and bring them forward into our medical education. For example, integrating telehealth into regular clerkship duties and innovating medical education based on what we are learning during this time. The needs and challenges of house staff are clearly very different, though they too are learners and have their own academic concerns. The data on this slide come from Mount Sinai, but I imagine these themes are quite generalizable. When crudely looking through some of our data, two primary themes emerged: academic and career worries, as you can see on top, and personal family worries. And you can see some direct quotes here. For example, fears of being unable to be sufficiently trained in subspecialties, effects on board exam scheduling for fellows and residents, and family and life concerns for those who have family who they are quarantined from, or even single physicians who are worried about their futures. So it is just important that program directors, department chairs be aware of these concerns to ensure that we have the resources in place to help our trainees. They are vulnerable and need adequate mental health support resources, educational and professional counseling, and reassurance from fellowship programs and employers that their careers will not be derailed because of the work they are doing on the front lines. So this was a non-comprehensive overview of the need of students and learners across the educational continuum. I've outlined some opportunities for support, which include guaranteeing protective equipment, ongoing opportunities for communication and transparency in all aspects of decision-making. This will not be the last pandemic, and we need to ensure that current learners are involved in the decision-making processes because they are our future leaders. 3, general leniency, understanding, and compassion, and whatever we can do to eliminate undue burdens on students. 4, continuing to promote the workforce efforts, but incorporating opportunities for students to reflect and make informed decisions about the ways that they are going to contribute, and destigmatizing the decision not to contribute. 5, proactive approaches to bringing mental health care to learners rather than waiting for learners to seek out these resources on their own. That includes peer hotlines, opportunities for learners to speak directly with colleagues and peers who they may be less reticent to communicate with. And finally, providing opportunities for students to embrace the good that is happening during this time, learn techniques in positive psychology, much of what we're doing at Mount Sinai that I'm happy to talk about during the Q&A. Thank you.